Thank you, National Rural Health Association, and those who were involved in nominating me for the Lewis Gorin Award. I'm very honored to be receiving an award that over the years I've admired other recipients who have achieved so much and contributed so much to rural health. My work in rural health started decades ago uh, and really started both in health services research and policy, and then with a focus on rural that I attribute predominantly to my spouse, Gloria, and her family living in the panhandle of Nebraska, really helped me have a deeply embedded appreciation for the people, for rural places, and the importance of making rural a place that is desirable and sustaining it as a place desirable to live and a choice people can have. I think that's crucial, and certainly the provision of healthcare services is critical for that. So that comes with a deep commitment that has to last over time. So I've been at this for decades, but I've been at it with others who are also deeply committed. People like Tim Size and Tom Dean, leadership in the National Rural Health Association and nationally. Along the way, I've had the opportunities to develop myself as a researcher and policy analyst in this field, beginning in the late 1980s, and then jump started really with my involvement in the Rural Policy Research Institute, starting in 1993. And the work that we've been doing, I want to really thank the leadership at RUPRI, particularly Chuck Fluharty, the founding director and CEO, and Sam Cordes, the initial chair of the RUPRI Health Panel that I've now chaired for a couple of decades. My engagement in the National Rural Health Association and in state associations in Nebraska and Iowa has provided further opportunity both for leadership and influence in the development of policy and help to rural providers struggling to sustain high quality services in rural communities. And it is a commitment that has to last for a long time, and we're all in this. And in my notes, I have we're all in it for the long haul. Close with that meaning that both we as current leaders and the future generation of leaders need to be committed and remain committed and continue to develop policy and practice in rural health. And we have an opportunity for that through NRHA's Leadership Foundation. I encourage all of you to be involved in that effort as well. So thank you very much for the award.